see the text. No one's watching.
This is Clarence. He is 1 year old today. These are his friends. Like all babies, they were born with 100 billion neurons, nearly twice as many as an adult, even though their brains are half the size. Their brains are growing faster than any other part of their bodies. 60% of their metabolism is being spent on growing their brains. By 3, their brain volume will have doubled. But those 100 billion neurons will not stay forever. As the children move, play, and learn, these neurons are being connected into circuits. Circuits that govern emotions, motor skills, and speech. The circuits that are used get reinforced. The circuits that are neglected get pruned away. What remains is a basic structure that will influence the rest of their life. It is how they will see the world. It will influence their thinking, feelings, their joys and fears. Most of how the world will seem, how they will fit, what they will do, will come from this brain. So if you want to change the world for the future, build the brain. Focus on these first 3 years. And in the first 3 years, parents make the difference. Build the brain.
Welcome. I'm live with Diane, Carlson, and Doug Robinson. Let's make sure they're online. You guys here?
We're here.
Sure are.
Can you hear us okay?
Hi, Josh.
Yeah. I'm lucky enough to have known them for many years. And they have very impressive credentials in government sector and financial sector. But today we're focused on some of their nonprofit work, particularly an organization that they co-founded called, I believe, Smart Colorado. Is that correct?
Yep.
So we're going to talk about that today. But you guys are dealing with sort of the intersection between mental wellness and substance abuse. And that's why we had you on today. And from that perspective, what do you think the biggest takeaway was from American Tragedy?
Well, first of all, we just want to say how incredibly powerful it was and how amazing how that was produced, that really just came from, you know, a parent that and her family that had just gone through, you know, mental illness hit them very unexpectedly. They didn't know what they were getting into, which is what it does for most people. And that she, you know, after, you know, you had to live through it, you had to survive it, but then she steps up and brings meaning and purpose to the experience by going to all the hard work and creating this movie. I think it's quite remarkable. I mean, she's an everyday parent that stepped up and made a difference. And I feel very inspired by what she did. And that's a lot of the story of Smart Colorado too. It was parents that were really worried as, marijuana legalization was being rolled out in Colorado, and we saw that no one was looking out for kids. And, we wanted to make sure that kids would be protected. So we and a bunch of other parents really stepped up on that issue. So the movie was incredibly powerful. And as I know Lisa knows, and a lot of people know, there are huge interconnections between mental health and substance use and abuse. And we'll share a little bit more as we go along. But just, Josh, the other thing I just wanted to share about the movie is, and maybe a lot of people felt this way, but it really made me feel uncomfortable, and really uncomfortable. And I remember I've seen it like 4 times now. Mm-hmm. And I had to really walk away and say, why is this making me so uncomfortable? And the other feeling that it did for me was it realized that when we feel uncomfortable is when we start thinking outside of the box and realizing what are changes that need to be made, and what does this mean in my life? What does this mean in our community? And Columbine had a huge, profound impact on me, our family, our kids, our schools, and our communities, as have many other very traumatic experiences that have happened, in our communities. So just a big shout out, really, to Lisa, parents to parents. It's amazing what she's done. And she went out and got all those experts, and she did such a quality job to drive this very important conversation about mental wellness. And she's my hero. We need more people that are like that. And that's how we change things.
Yeah. Well, we're excited to hear about some of the work you've done. I want to make sure we have a clip we can watch from the movie real fast. Do we have that, or is it ready? Give me a second. We're going to get that ready. Just where we talk about the intersection between mental wellness and substance abuse in the documentary, just for people who haven't seen it, just so that we can get everyone on the same page.
Sure.
So give us 1 second to pull that up.
Sure.
I think we're to the point where we could show you evidence of the effectiveness of preventive interventions for virtually every psychological and behavioral problem. We can prove that prevention works. We have tons of evidence on it. Name a problem. Depression, we can prevent aggressive social behavior. We can prevent anxiety. We can prevent lots of problems. Because if you look at the data on effective preventive interventions, they don't prevent just one problem.
That it's not that we just have, here's the risk factors for suicide, and then here's the risk factors for substance abuse, and over here are the risk factors for truancy, and over here is violence, and over here is bullying. That these things, they have shared risk factors, and they also have shared protective factors. So if we do our job well, and we do upstream strength-based prevention well, we're gonna have an impact on suicide, but we're also gonna see an impact on substance abuse, and on truancy, and on violence, and on grade point average. It's a lot easier to focus on your science when you're not constantly in crisis. That really at its core, at its heart, it's a wellness model. That what we're after is we're not just trying to keep people alive, but we're trying to really help people live healthy lives and really help people and communities thrive.
So I just wanted to share that clip just because this gets at what I'm excited to learn about from you guys today, is just these connecting points between all these different problems or issues in society. They're so intertwined, and it's not just this one-off problem. So I would love to hear about some of the work that Smart Colorado is doing, and I believe you've prepared a little presentation on what you guys are doing. Is that true?
Yeah, we have probably about 15 minutes of slides we'll go quickly through, and then we want to take questions and make sure that we answer any of the thoughts. But just to start, this experience for us, if you would have asked us 20 years ago, would we in the future be experts on marijuana and its impact on kids and adolescent brain development, it would have been the farthest thing from our, to happen. But it started for us, our youngest child at 1 year old, started at 1.5, I guess, came in and fell down and had a grand mal seizure. And we were trying to figure out what was going on. And within a month or so, he was having more and more. And then within 2 or 3 months, he was having 80 to 100 seizures a day. And
Wow.
every 10 minutes, he had a helmet on, he'd fall over, and his brain would reboot. And when something like that happens, your world suddenly falls apart, and that's the focus. And we had other children, and we tried to figure out what we could do. And so that led us to a path of really, Diane, of researching the brain and trying to find out as much as we could about this remarkable thing that we have on the top of our shoulders that allows us to think and to reason and to feel and to make choices. And we were, successful in coming up with a solution with the doctors that was really wonderful for our child. And so that happened just at about the same time as we came up with a solution that marijuana was voted by the people in 2012 to be legal for adult recreational usage. Adult use in Colorado, the first state to do that. And Diane went down to the governor's task force shortly after the vote to try to come up with the rules for this new industry. And we were, concerned about what was going to be the impact on youth. And of 6 priorities, the task force ranked protecting youth and public safety as the last of the priorities. And so that's what Smart Colorado was born out of in our living room, as others, I think Henny Lastly, our executive directors on this phone, Gina Carboni maybe as well. We had a handful of people in our living room saying, what are we going to do about this? And who's going to look out for kids as marijuana is commercialized? And so our journey started then for this organization as we thought that we could maybe do something about it. So with that, I'm going to share our screen. And
yeah, I'll just chip in while you get it set up. That, yeah, you don't think, you just realize, you hear one day that it's legal and you don't think of all the ramifications that then follow. You have to figure out how to regulate it, how it's going to be shipped in, how it's going to be banked. When there's a federal law that's different, because this is this huge thing and people have to step in and start figuring it all out. And you guys were some of the people that did that and looked after kids. Yeah.
Can you see, Josh, are we good with the screen sharing?
We see the screen.
All right, so Diane's going to quickly take us through about 20 slides here that I think will give kind of an overview as to what we've been focused on and some of the challenges as we see them, and then we'll open it up for questions.
And I'm going to pause real fast just so I can give people a phone number that they can text in questions as we go through in case a question comes up. So this phone number will be listed next to the video that you're watching if you're watching this live. Otherwise, you're going to give it to me. It's 307-655-639-6. There you go. She was signing it to me. So that's the number that you can text. It'll be again on the screen next to the video. So if you have any questions, please text them in. You don't need to wait till the end. You can just text them right away, and we'll then ask those questions once they're done. So take it away.
Great. And as Doug said, the one thing that we never thought was just how dicey of an issue we were getting involved in. And, it wasn't like we knew a lot about marijuana. We just wanted to make sure that it was going to be regulated and kept out of the hands of kids. So it was a huge learning curve, and it was shocking how just one goal, looking out for kids, could be so controversial and so dicey. And that was interesting for me. So again, the stakes are high. Our kids only get one chance to grow up, and that's why we formed. And just about Colorado, again, the sole focus was protecting kids. We're a nonpartisan effort. We've been endorsed by 4 of Colorado living ex-governors. There has been the active engagement of thousands and thousands, and that's the only way we were able to accomplish some really meaningful things on the policy front. This just kind of outlines, it's a roadmap. I'm sure it's really hard to read, but 7 years in, it's just highlights some of our major accomplishments. And really just because we were there and we took action, we got some really important things into law, including that there needed to be a THC potency study and that THC potency, which is the psychoactive ingredient in marijuana, which has been tied to the harms, that it had to be on the label and childproof packaging, and that there had to be some of this information. And quite frankly, we had a lot of pushback on those things. And so today, just the understanding we have about some of these products, we really wouldn't have it. It would be a big black box. And I think that's some of the most important things that we accomplished in those first couple of years. So the other thing that we learned is there is a big difference between decriminalization and important criminal justice reforms, which I know a lot of people are talking about today, that are very, very important, and between legalizing marijuana for medical purposes, and we'll get into detail a little bit on these, then legalizing marijuana for recreational adult use, and then versus full-blown profit-driven commercialization.
Which is what Colorado adopted. Other states have taken different approaches on this, but Colorado's gone full throttle on commercialization.
But again, not in every jurisdiction, but it's a big difference. So this,
just to give you a sense on that, so this is currently looking at the medical marijuana dispensaries and the recreational dispensaries compared to Starbucks and McDonald's, and you can see that there are more of them than there are Starbucks and McDonald's. So they're all over the state. But an interesting point is that 70% of Colorado jurisdictions, not on a per capita basis, because Denver and Pueblo, some of the big ones are in, but on a number of counties and cities basis, have opted out of recreational sales. So most of the state out of the Front Range, it's still not legal on a recreational basis.
Right, and something to note on this, and we'll get more into it, but this is just the stores. With commercial marijuana has come cultivation centers, product manufacturers, transporters, and now, last legislative session, jurisdictions can decide if they want to opt into delivery and actually on-site consumption. So the commercialization only continues to expand unless the jurisdiction has opted out. This is just showing that there is tremendous confusion, just like with the terms of legalization, decriminalization, there's tremendous confusion about, okay, what are we even calling marijuana? And do you want to hit the next slide?
Yeah.
And it's certainly not just a plant. The products that are being sold in Colorado today look very different from what I think a lot of people, when they voted for it, thought it was going to be. Do you mind just hitting? And this just shows you the THC potency, which again, I know that that's something we've really focused on because science showed that it links to impairment, but it links to the harms. And we're still finding out more about that, but definitely links to the harm for kids and the developing brain. And if you look at this chart, 2% marijuana, the research showed it was 2% or under from the 1960s, actually up till right at 1980. Then 1980s to 90, it went to almost 4%. In Colorado, and once again, this was not easy to have happen. We had to pass legislation about a study, had to be done for us to start focusing on what was the THC potency. And as you see here, the bud, the leaf is at 19%, and concentrates, which will go into these products, are at a whopping 68%. Just to put this in perspective, health experts like in the Netherlands and in other areas have said anything over 15% THC should be treated as a hard drug, should not be considered as marijuana.
And there's an increasing body of evidence showing that there are some positive medical effects related primarily to the CBD side of marijuana, but nothing above 10% has shown any positive effects. And indeed, as you get much above that, there's links to psychosis and schizophrenia and pretty significant mental illness. So this understanding of the difference between the potency and also that CBD, which is an ingredient in the plant, does have some positive impacts for health in certain cases, while THC can in high doses or high potency be very harmful.
Right. And this is just one of our campaigns because there's been so much misunderstanding. so many parents are thinking this is the marijuana that they used in college, you know, from the past. It's not a big deal. And that's where the problem has really come with commercialization is this is not the stuff that you remember. There are deceptively different products. It is very hard to know how much THC is in some of these products, and, you know, and very hard to know the actual impacts. And these are just, Doug will just kind of go through these, but these are just to show you some of the products and how confusing it can be. This inhaler has a very high level of THC, and yet, you know, you don't know that. And then the other thing that's been really
and kids could be sitting in the back of class, and they do, and you know, the teacher thinks they're you know, getting, you know, using the inhaler for asthma, and they're really using it for another purpose.
Yeah. And the other thing, just on a note, we're very sensitive because we know a lot of the families that want to use, you know, Colorado's marijuana to help their kids with seizures. And they are not using these high THC products. I mean, they are using CBD, you know, these low THC products, but yet the perception has been that those are the products that they are using. And that's the same with a lot of the athletes. They'll be talking about CBD. That is very different than these really high THC products. And this is just a slide showing that the US Surgeon General, he has come out and he has said, look, this is really serious when it comes to our adolescents and pregnant women, pointing to the fact that the earlier use happens, potentially leads to more and more adverse impacts. And that's why the stakes with kids and pregnant and breastfeeding women are huge. Unfortunately, with commercialization, you know, the perceptions of harm are going down, and research shows that that is a very strong indicator that youth use will go up. Again, we were, you know, Josh, you live here, we were all promised, you know, this was going to be tightly regulated, it was going to be controlled, it was going to be kept away from the kids. And yet kids are being harmed. And this is just some of the harms. There's a lot more coinciding with commercialization. We're one of the highest youth marijuana use. We have the highest teen vaping rate in the country. It is twice the national average. We have more high school kids that are reporting using these concentrates and using them in very dangerous ways and consuming edibles. You've got more marijuana-related emergency room visits for adolescents, and 71% were also diagnosed with depression, anxiety, mood disorder. You've got an increasing issue with the drug driving and marijuana-related fatalities, and really concerning data about those that drive and are high do not view that it's dangerous. And the CDOT did a report that 27% report that they drive high every day. You have a lot of studies continuing to confirm the negative impacts on the developing brain. It's a recent study by the University of Colorado showing that nearly 70% of 40 dispensaries that they contacted that were both medical and recreational were recommending marijuana to pregnant women, which, by the way, we passed into legislation to get a warning, and we mailed the signs to every dispensary so that could be posted. That was a huge accomplishment, but that's very disturbing that that was happening. Once again, the vaping crisis is very serious. We know a lot of people that have been very negatively impacted for the rest of their lives. And
this is just, if you see the screen here, the dark is the healthy, and on the right is a normal 17-year-old boy's chest and lungs, and you see the healthy lungs. And this is a boy that's been vaping that needed to have a lung transplant. And you can see that there's almost no dark area. He was described to have the lungs of a 70-year-old at 17. So very, very, very concerning.
So, you know, Colorado's just trying to figure out like what's going on with all this. I mean, and a lot of people would say we're really behind the eighth ball. But in a recent statewide survey, 15 to 17-year-olds that were smoking and vaping were 5 times more likely to use marijuana. And the kids that were vaping in this survey, when they asked what's in your vape pen, 25% said some form of THC, 27% said nicotine, and 78% said that they thought they were vaping flavored water. And that is what is the most disturbing of all, is these kids don't always even know what they're vaping because it's so deceptive. And these concentrates can be really concentrated, so the impact is very harmful. Do you want to say that one? Or?
No, go ahead.
Oh,
Yeah,
okay.
yeah.
And then in that same, survey, it just shows that once again, kids that are experiencing, difficult mental health days, 6 days or more, are more likely to use substances, alcohol, marijuana, and prescription pain relievers. So again, the connections with, it's not only that if you start young, you can develop these mental health challenges, and that can be very far reaching. I mean, they can affect you, for the rest of your life, but it's also, if you are struggling with it, you may, use some of these things that are really harmful.
All right, so we need to kind of wrap up.
Okay, I'm sorry. This just shows, this is just a map of the stores in Denver. And I'm sorry, you can't really see. It's incredible where they're concentrated. A lot of times are in these neighborhoods that are already dealing with multiple risk factors, very serious, including poverty. And yet these outlets are getting put in those same neighborhoods. So you're having that same overburdened child and community dealing with another harm and risk, because the risk from outlet density, the science is in on tobacco and alcohol outlet density.
So this is an important recent study in Colorado that came out looking at completed youth suicides. And as you know, Colorado is among the very highest of all the states. And unfortunately, it's going up. And unfortunately, in the tox screens of the children, marijuana is the most double alcohol in terms of the most prevalent substance found in the 10 to 19-year-olds. So this is a very concerning fact. And so another thing here, as you know, during the pandemic, marijuana stores were called essential. And we were involved trying to make that not happen. But the industry is so powerful and so well connected politically that it was essential. And this just shows the through early March, the numbers slope a little bit down past there, but a great deal of use, across all ages during the COVID pandemic.
Which is really concerning when it's such a stressful
I think
time.
we should probably just skip through.
I think that's it. I think it's okay. But
okay.
I mean, this is just showing that the industry, I mean, we've watched it in Colorado. It has become extremely powerful, and they need to hear from citizens. And this is just showing at the Capitol, the same things starting to happen at the Capitol, and they are making some really key decisions. One of them is around possibly marijuana banking that would be huge. They need to know from citizens and parents that we need to be thoughtful on this, because it's a big pot levy. It's very powerful. And this just shows the high priorities that we are now advocating for, and we've been advocating from the start. But limits on THC potency and the products, opting out of commercialization, or at the very least, strictly limiting it. We need robust education. We need full disclosures in education in the store so people know what they are getting. They are coming home and using those things. They need to know. And research and strict minimum age requirement of 21. And this is just, together, we have just seen the power of parents taking the time, whether it's to go to a hearing, go to your city council, send an email, make a call. It is powerful. They listen to that. And so we can all, have an impact.
Awesome. Thank you. That was great.
Nobody go too long. Sorry.
No, that was great. I have a few follow-up questions myself before we turn to viewers' questions. I wanted to ask about, you talked about people voting for this. Maybe there was some confusion in what they were actually voting for. Do we know much about what the public opinion is now? Is it generally, do people support commercialization, or are more people in favor of decriminalization, or I guess what's the public opinion right now? Do we know that, or do we not have studies on that?
Well, when you watch the surveys, it's all how it gets asked, right? Are you for legalization? And so that's what we've noticed is there's a lot of confusion. It all gets kind of dumped in the same bucket. I think most, I can't speak for the whole public, but I think there is people would like no one going to jail for using small amounts of marijuana. They want the criminal justice reforms. Nobody wants anybody's lives being hurt by using marijuana. I think there is a general consensus around that. And then I think it comes into, okay, so what should we legalize and make available? And what should we wait until we have more research? And you do have some states making some very thoughtful decisions on that. So it's really in flux, but I think that everybody thinks when you say legal marijuana, it means what we did in Colorado. And again, you got to remember 70% of our jurisdictions in our state opted out, which is really interesting. So do you want to add anything to that?
No, that's good.
Okay.
Yeah.
Okay. I was going to ask another question, but it looks like it's a viewer's question. So we'll just skip to the viewer's question. To talk, they ask about the correlation between suicide and THC. Is there any understanding of why they're correlated? And I'm just going to, that's the end of the question, but I'm going to ask maybe a refining question. For example, do we know why they're using the marijuana? Is it to deal with the depression, or is it causing the depression? Do we have any science on that, or is that an unknown? Is that an open question? How are they related? What do we know about it?
Yeah, you know what? There's a lot of people now looking at a lot of these issues. And the problem is that, a lot of universities haven't been able to have access to do the research on the actual products that are being sold in Colorado. So there's going to be more coming out of that. And I just want to be really careful. When we showed that graph, we were not saying causation. Yeah. We were just saying that this is data and, it's concerning, right? And so I think we're really not the experts on that. And I think, there's going to be more and more people looking at these issues, and they actually really are. I mean, there's
been studies, linking high potency marijuana to violent behavior, right? And not only suicide, but also murder and other. Alex Berenson wrote a book, New York Times reporter, that was published last year. Really trying to show that link between. He interviewed, research in the prisons and so on. So there is some linkage on that. More studies need to be done. We can't really answer the causation question yet, but it's profoundly disturbing that, that's the number one substance in the tox screens.
Yeah.
Well,
could I just add one more thing? That's really interesting is that NIDA, because we reached out to a lot of researchers.
That's the National Institute of Drug Abuse.
Yeah. Is really concerned about this, and we're asking for submissions on this, like what should be a standard dose, and the executive director was mentioning looking at a 5 milligram, making things dose specific, which would mean a cap on THC that would correlate to the finished product at 5%. So there's conversations around this, and the problem is the products have just taken off, and there's constant innovation, and so it's really tough because they're having these conversations, but the development of the products are far beyond where those conversations are.
But just one other thing, because since we started this, people call us, and we probably have heard a dozen stories of parents calling us, telling us about their children getting into high potency THC and taking their lives. Really tragic ones. Started with this couple, the Bullards from Texas, who were supportive of marijuana use, and their son was a valedictorian at SMU, gets hired by KPMG, great firm, consulting firm in Denver, doesn't know people, moves in with 6 other guys. They introduce him to dabbing, which is the high THC, consumption. And he was keeping a journal, and you can see the mental health deterioration And he got to the point where he thought that he couldn't think clearly and took his own life. Just after that, these are people that have gone public with that. A family that went to Arapahoe High School, where the kid went off to college and got into high potency marijuana, came back. His parents tried to restrict it from him, and he killed himself with a kitchen knife with his mother standing next to him in the kitchen not too long ago. So just some terribly tragic situations and I can go, there's 8 more stories like that.
Right. And just to add to that too, what's really disturbing, we're working with a lot of parents that are trying to advocate to, not continue to add more outlet density to their communities, and kids that started when they were 11 and 12. And oh my gosh, when you listen to the costs they went to and all the doctors and all the experts who said this could not be because of marijuana, when now we're seeing, that constant throwing up, the hyperemesis syndrome, there's these things now that they're getting more information on, and they are finding that it is related to high THC marijuana use, where these poor parents, they just spent years and years, every dollar they had, and they couldn't figure out what was going on with their kid. And I find that really one of the most disturbing things of all.
Yeah, interesting how the innovation in the field is making it very hard to regulate it, because it's always changing. And maybe we should have seen this coming, because this has happened with other products like alcohol and other things. So it's not new. Maybe we could have stayed ahead of it, but apparently we didn't. And so now we're having to sort of try to catch up. So we have another viewer's question, and they ask, how do you go about reducing the harm of marijuana while also reducing incarceration rates for drug use? So what do you see as sort of the happy medium?
Well, it's this conversation about decriminalization versus full commercialization, and we're supportive of decriminalization, and that is something that could happen across the United States, where people, especially often people of color and people in disadvantaged neighborhoods, are not using something, and then they go to jail, and they don't have that's a problem for them in their lives. And so decriminalization is something that could be pursued, and we just have to be really thoughtful. That's part of our mission, is for people to understand and be educated about the difference between CBD and THC and the potency of THC, and if that information gets out there, if there's more research, I think we'll make better decisions. But the marijuana industry is just in a full-scale rush to try to legalize across the country and get access to Wall Street and so on as fast as possible, because of the money incentives that are there for them.
Yeah, and Josh, can I just also say, we're really involved on the marijuana statewide education campaign. So one of the things we've been saying is, there needs to be more education, so that when people come in, like the person behind the counter really knows how to advise them. There needs to be more standardization. There is a lot of concern around that. And I know a lot of people in the industry too, that are really, really concerned, and they're nervous. They know this is dangerous right now, the situation we have. And the other thing that's really interesting is that our US Congress has legalized CBD and, hemp. It's what it basically means is it's, the THC in it is less than 0.3%. And so you have all these products that can be sold everywhere. And so it creates a really interesting opportunity, because they can be sold in these dispensaries now. And so we really could start to find ways to standardize THC, to educate on it, and to limit the harms. And in a way, it's kind of an opportunity right now, because no one has to go out of business. But the other thing is, you could just strictly limit the commercialization and the advertising and the marketing. I mean, right now, you know, there is research showing that social media influencer campaigns, I mean, this stuff is reaching kids. I mean, you know, you drive around Denver. I mean, the Green Cross, it is very confusing. It feels like it's all, we're setting the message, it's all benign, it's a wellness product. It's very confusing how we've structured it.
Yeah, that makes sense. We have another viewer's question that's asking, so you mentioned states that have made maybe more thoughtful decisions. They were asking, what are those decisions? What are like better states that have done a better job? Do you know?
Yeah, well, I should be careful about that because the jury's still out, but there were states that like limited the THC potency to like 5%. There's some that have done it at 2. I've got kind of a whole graph of it. I mean, the problem is that the ones that have just gone straight into the, you know, commercialization, a lot of them don't even have some of the protections that we helped with others to get in place in Colorado. So it's like all over the place. And so you can go to California and maybe have one experience, you know, you go to another state and you have another. And I just think the problem that we have to remember is it's so confusing and it's hard to understand that we need to send the message to candidates that are running for office and elected officials that we have their back. Like, we want kids to be protected. We want public safety. You know, we don't want to harm those neighborhoods that have already been so unfairly harmed. And now they're not only going to have all these outlets with tobacco and everything else, but now they've got, you know, marijuana grows and they got the stores and they've got the infused. I mean, we worked with community groups in Denver. I mean, I just could not believe what I watched to try to cap, you know, the amount of outlet density, you know, in their neighborhoods. And I mean, it was depressing.
But it just as a start, several states have said, you know, products that are appealing to children, bubblegum flavored, you know, gummy bears or lollipops or these sorts of things, you can't put marijuana in them. Okay. In Colorado, we have some of those restrictions, but not to the full extent. So that's a basic one where you can't put bubblegum flavor into cigarettes, right? Why should you be able to put it into a vape, THC vape, and have kids, you know, so there's some stuff like that other states have maybe gotten a little ahead of where we are.
And something to remember, like even with Jules, the big, you know, everyone's bringing a lawsuit. I know our AG in Colorado is really concerned about this. He knows that the vaping situation with THC is very serious. And those pods were, not only were they kid friendly, but they were more concentrated. So a cigarette will have like 1 to 2% nicotine, and the pods were having like 5 to 7. And so it's incredible when you think about the THC and marijuana. But once again, people will just say, well, we don't know, we don't have the science, so we should just allow everything, you know? And that's what we saw continually through all our efforts is, but just there is researchers now that are saying, look, the research shows that nothing over 10% has been shown to be beneficial for any medical condition. So guess what? We should cap medical at 10% because there's a lot of concern that medical, you know, people are perceiving it as a health product and that it's safe. And so it's dangerous to allow any THC because the perception is that this is kind of a wellness, you know, a medicine product. So that those misperceptions and the fact that there haven't been any limits are what make it dangerous.
Yeah, that reminds me of the moment in American Tragedy where we talk about cigarettes, where there were ads talking about how doctors use them, and there was this whole healthy campaign that, you know, people felt that it was the healthy thing to do. So that's interesting that a similar thing has happened with marijuana. So we don't have much time left. I just wanted to give you an opportunity to give us 1 or 2 action points, some takeaways for people that are listening on this point.
Well, I would say if this strikes a chord with you, get involved, right? And the probably the most impactful, one of the most impactful things to do is to, write a letter to your senator or your representative and express your concern about kids and about, substance use of any kind and mental health and so on. You can go to our website, smartcolorado.org. We have a tool in there that allows you to instantly, if you don't know who your state senators are, your state representatives or whatever, you don't know how to reach them, our software allows you to send them an email pretty instantly. So that's something that you could do. We'd love to hear from you. Just get involved is the main thing.
And I just want to say, if you're somebody that cares about mental health, and this is one of the most far-reaching issues in our country. I mean, honestly, the misinformation, the misperceptions, everybody can talk about marijuana and think of it as something different is really concerning. And our kids need our support. I mean, we work with kids all the time and they feel like all the adults around them just think, hey, we're getting all this tax money and this is great, it's not harmful. And we need to be examples and we need to support them. And they are feeling incredible peer pressure. I mean, we've seen it ourselves. I mean, we were getting death threats. We were getting all kinds of things. Thank heaven we're done with all of that. But it's hard to stand up and say to your friends, you guys, this could really harm you when you've got just your entire culture around you is saying that this is like a safe way to recreate. It's a safe way to feel better. And, it's a medicine. I mean, Doug and I, we went through the whole nightmare with our youngest son and we literally woke up. We had 4 kids in middle school and high school, and they thought there was absolutely that marijuana was amazing. It could help you with anything, cure anything. And we were absolutely shocked. And then we went on to find out that all the kids we knew, were thinking this, and a lot of the adults thought it too. And, everyone's thinking it's the CBD and the really low THC. And it's been very interesting. So it's a big issue. It's an important issue. There's a lot of opportunities to get involved. It's fascinating. And we are just in, the first stage of where this is going. And as you know, Josh, I mean, we've already seen in Colorado, I mean, those stats, I mean, those are kids, those are real people, those are families, those are, and we've seen that in this movie, the trauma from Columbine and all these other incidents we've had, they impact us all. And they're impacting, and that the culture around these kids and feeling that they've got adult support and that we're, looking out for them. And I know it's a big responsibility for parents, but it's a big responsibility for all. We're all in this together. So we really appreciate everything you've done, and Lisa, this movie, and Parents to Parents, and everyone that participated. It's so impressive, and we're grateful that we got to be a part of this conversation.
Yeah, thank you.
Yeah, well, thank you very much. And it certainly strikes a chord with me. It makes sense. We've had very similar situations with alcohol and assumptions around it, assumptions around what college students should do and what's acceptable amounts of alcohol, and just misinformation, things people just not understanding, and different words meaning different things. It's a common problem with these substances. So I don't think it should be surprising that it would be a problem here. And hopefully people like you can help, because it definitely will have an impact on our society. So for those watching, please subscribe to our YouTube channel. We'll be back with another conversation most nights for another week. So I think every night but Sunday night. So just join in. You can see the schedule on our Facebook page, American Tragedy Movie, or on our website, americantragedymovie.com. So again, thanks, and have a good night.
Thanks.
Thanks.
Thank you, Josh.
All right.